So let me try to explain how we got here briefly. So as everybody knows, we started what became known as a pandemic back in 2020, the beginning of 2020, and the Secretary of the Department of Health and Human Services determined that a public health emergency existed because of those cases of what was then known as 2019 nCoV. And then that in turn triggered a declaration that there were circumstances that justified authorization of the emergency use of in vitro diagnostics for detecting COVID-19. And this is where FDA gets its statutory authority to require emergency use authorizations for IVDs, as well as other types of COVID products, drugs, and many other kinds of PPEs and other devices. Now, whether that authority does or should extend to LDTs is debatable, but clearly FDA has made the choice to do so. Whether FDA would do so was initially unclear at the outset of the pandemic, and certainly it was not required for FDA to do so. And now, if you'll indulge me, this requires a brief digression into the broader history of FDA's oversight of LDTs, because to understand what happened in the pandemic, really need a bit of context for the instability and the source of that instability that I referred to at the beginning. So as most people on this call likely already know, in vitro diagnostics are products that clinical laboratories use to perform testing. They are regulated as medical devices under the Federal Food, Drug, and Cosmetic Act, which includes instruments and other types of products, including in vitro reagents that are intended for diagnosis of disease and conditions. And then there's a further definition of IVDs in the regulations that is more specific. Like other medical devices, IVDs are regulated on a risk-based based on risk-based prioritization, class 1 being the least risky, class 3 being the most risky. All devices, regardless of risk, are subject to certain general controls, such as registering with FDA, listing products, reporting and record keeping, compliance with good manufacturing practices, or what's known in the device world as QSR, and sometimes submission of 510K premarket notification, or even in rarer cases, the submission of a premarket approval application. And then beyond class 1, for devices that FDA believes need additional oversight, special controls such as performance standards or patient registries can be required as well. And under the statute, there are a variety of penalties that manufacturers of devices can face for noncompliance. LDTs are tests that are performed in clinical laboratories. Now, they may use and often do use IVDs, but they are developed by the laboratory as opposed to being purchased as a kit that's already assembled. Laboratories are regulated under CLIA, the Clinical Laboratory Improvement Amendments, which applies to all laboratories that test human specimens for diagnosis or health assessment. CLIA certification is also tiered based on risk, and labs must have the type of CLIA certificate that is commensurate with the type of testing they're performing. Now, CLIA sort of has a different approach than the Food, Drug, and Cosmetic Act to regulation. CLIA is a lab quality statute, so focuses on the appropriate training and qualifications of the personnel, how records are conducting, how things are reported, making sure that laboratories are doing proper analytical validation and proficiency testing and doing periodic inspection. Unlike FDA, which can require pre-market review of tests and can require evidence of clinical validity, CLIA really leaves a lot to the discretion and the responsibility of the laboratory director to make sure the tests are appropriate to be offered and appropriately performed once they are offered. And CMS oversees CLIA in conjunction with states. both have the authority to revoke certificates for noncompliance. So there are penalties under CLIA as well, although slightly different. Now, turning to how did LDTs get into the mix? Excuse me. FDA got authority to regulate medical devices in 1976. Initially, when FDA issued regulations to implement this law, laboratories were carved out. FDA said full-service laboratories and similar establishments are exempted from registration as medical device manufacturers. This changed beginning in the 1990s. FDA asserted that LDTs were actually a type of medical device, and laboratories therefore could be regulated as medical device manufacturers. But FDA articulated what's been a policy of quote unquote enforcement discretion, meaning the discretion not to enforce laws they're entitled to enforce. When questioned about the fact that labs had been carved out earlier in the regulation, FDA has said that today's laboratories and today's tests are different from what they were talking about back then, and so a different approach is justified. So we've been in a period of mostly enforcement discretion for a number of decades, with periodic departures and sometimes sudden departures from that policy for tests that FDA views as posing higher risk. And for example, labs offering tests for cancer screening, direct-to-consumer genetic tests, pharmacogenomic tests. These are examples when FDA has expressed concern, and the way FDA generally expresses concern in the first instance is by sending a warning letter to a laboratory that is offering the test saying this is a medical device, and if you want to offer it, you need to get appropriate premarket review. There have been episodic proposals by FDA for a comprehensive regulatory framework that have not to date come to fruition. But as comes as no surprise to anybody on this call, I'm sure, this has generated much uncertainty over many years in the laboratory community. I'm not planning to go through this slide, but this timeline, I think just the visual is a way of showing just how much churn has happened in the past 2+ decades with respect to LDTs. And sometimes it seems like much has happened and little has changed. So let me just point, and the story here really is episodic attempts by FDA to regulate LDTs, episodic exercise of enforcement over certain types of LDTs, and then ultimately no systematic approach to the regulation of LDTs. So the yellow are all the times that yellow highlighted words are things that FDA has expressed concern about and sought to regulate. And then the green highlighted terms show where FDA pulled back and then did not finalize a regulatory approach.